Hello, this is a recording of Chapter 29, the Cardiovascular, Circulatory, and Lymph Systems lecture. Chapter 29 begins on page 460 in the textbook. We're going to start with figure 29.1, which is a figure of the heart, or diagram rather, of the heart, and this is found on page 461 of the textbook. The anatomy of the heart begins again on page 461 of the textbook. So the circulatory system is composed of organs and blood vessels that transport oxygenated blood to all parts of the body. It's made up of the heart, lungs, veins, arteries, and capillaries. Pericardium is the double layer of serous and fibrous tissue, fluid-filled sac surrounding and protecting the heart, permits free movement of the heart during contraction. Endocardium is the innermost wall layer, covers the inside surface of the heart. The myocardium surrounds the heart, causes the chamber contractions. So the heart has four chambers. Atria, this is the top two chambers. There's a right atrium receives deoxygenated blood from the body, whereas the left atrium receives oxygenated blood from the lungs. And then we have the ventricles, which is the bottom two chambers. The right ventricle pumps deoxygenated blood to the lungs to pick up oxygen and drop off waste. The left ventricle, which is the strongest chamber, pumps oxygenated blood to the rest of the body and back to the heart. The septum divides the heart into right and left sides. Heart valves direct blood flow forward in one direction and prevent backflow. So there are a number of valves to help with this. The tricuspid valve is between the right atrium and the right ventricle. The pulmonary valve is between the right ventricle and pulmonary artery. The mitral or bicuspid valve is between the left atrium and the left ventricle. The aortic valve is between the left ventricle and the aorta. So on page 462, we're going to look at blood. This is liquid tissue. 5.6 liters are in the average adult body. Carries oxygen, nutrients, hormones, disease-fighting cells, and other substances to all parts of the body. Transports waste to the kidneys for filtration and to the lungs for expiration. Blood is composed of erythrocytes, which are red blood cells. There are millions per drop. And leukocytes, the white blood cells, 7,000 to 25,000 per drop. Platelets and plasma are also found in the blood. So figure 29.2 details the blood flow through the heart, which direction it's going, where it came from, where it's headed to, and that is found on page 462 in the textbook. Function of the heart, page 462. Every body cell needs oxygen to live and function properly. So the heart pumps or delivers oxygen-rich blood to all body organs, tissues, and cells. Atria fill with blood simultaneously and contract, pushing blood through valves into ventricles. While relaxed, ventricles fill with blood and contract simultaneously to push blood out of the heart through the pulmonary valve and aortic valve into the lungs and the rest of the body. Atrial contains nutrients and oxygen. It is bright red and oxygenated. Arteries carry oxygenated blood to the body to feed and nourish all the body tissues. The venous blood contains waste, primarily carbon dioxide. It is dark red and deoxygenated. Veins carry deoxygenated blood to the heart to be sent to the lungs, where external exchange of gases occurs. The conduction system or electrical system of the heart. This is beginning on page 463 in the bottom right corner. So this controls the speed of the heartbeat. Spontaneous contractions of heart muscle cells are coordinated by the sinoatrial node or SA node. Autorhythmicity allows the heart to generate its own electrical stimulation. The electrical impulse generated within the SA node is known as the natural pacemaker. Impulse continues through atrioventricular or AV node, which acts as the electrical bridge into the common bundle of the AV bundle, through the left and right bundle branches of Purkinje fibers. So the cardiac cycle consists of diastole, which is when the ventricles are relaxed. Atrioventricular valves open to allow blood to pass into both ventricles. And systole, which is when the ventricles contract. The right ventricle receives electrical impulses from the Purkinje fibers and contracts simultaneously with the left ventricle. Hypotension is the first disease of the heart that we will look at. This is beginning on page 464. Hypo, meaning low blood pressure, means it's below 90/60. This can cause inadequate blood flow to vital organs, such as the brain and heart. It can be caused by prescription drugs, over-the-counter medications, other everyday stimulants, advanced diabetes, anaphylaxis, heart arrhythmias, dehydration, fainting, heart attack, and heart failure. So table 29.1 on page 464 details prescription treatments for hypotension. Then we're going to look at hypertension, which is a sustained elevation of systemic arterial blood pressure. Symptoms include severe headache, chest pain, irregular heartbeat, fatigue. Greatly increases the risk of heart disease, liver failure, heart attack, and stroke. Treatment includes reducing stress, exercise. Pharmaceutical treatment includes diuretics, vasodilators, ACE inhibitors, beta blockers, and calcium channel blockers. The figure 29.2 details prescription treatments for hypertension. This begins on page 465, goes through 466, and wraps up on page 467. And I'm just going to scroll through the slides and let you look through your textbook at those charts at your leisure. Next, we'll look at congestive heart failure. This begins on page 467 in the textbook. This is decreased contractility of the myocardium. For example, the heart pumps out less blood than it receives. Results in a weakened and enlarged heart. No known alternative therapies for or over-the-counter drugs. The symptoms of congestive heart failure include an upright posture or leaning forward, sort of a barreling of the chest, anxiety and restlessness, cyanotic and clammy skin, persistent cough, rapid breathing, fast heart rate, edema of the lower limbs. That's a swelling. Ischemia is on the right-hand side of page 467. This is a condition in which oxygen-rich blood is stopped, blocked, or restricted to a specific part of the body. Cardiac ischemia refers to a lack of blood flow and oxygen to the myocardium. Temporary blood storage causes angina pectoris, which is pain in the chest and heart area. Sustained ischemia leads to myocardial infarction, which is what we will look at next, myocardial infarction. This is death of heart tissue, and it can be fatal. Heart functionality is reduced with each myocardial infarction. Crash cart medications for cardiac issues would include atropine, beryllium tosylate, calcium chloride, dextrose, diazepam, diphenhydramine, dopamine and dextrose 5% water, and epinephrine. Furosemide, hetastarch, isoproterenol, lidocaine, lidocaine and dextrose 5% water, magnesium sulfate, midazolam. Table 29.4 on page 468 details prescription treatments for congestive heart failure. Angina pectoris. This is short-term blood shortage to the heart, commonly called chest pain. This is most common medications for this would include nitrates, which relax smooth muscle and dilate blood vessels, beta adrenergic blockers, which reverse heart action, and calcium channel blockers that block calcium from smooth muscle cells and myocytes. Table 29.5 on page 469 details prescription treatments for heart conditions. Next, we'll look at arrhythmias. Arrhythmias are irregular heartbeat pattern or change in force or speed of the heart contraction. Occurs in the atrium, ventricle, or both at one time or at irregular intervals. Ventricular fibrillation is the most serious, which is a medical emergency. Slow heartbeats are referred to as bradycardia, and fast heartbeats are called tachycardia. Antiarrhythmic drugs, this is page 469, restore normal rhythm patterns, but do not cure the cause of the irregular heartbeat. So class 1 antiarrhythmic agents block influx of sodium ions to excitatory membranes during depolarization and excitation. Class 2 antiarrhythmic agents block release and activity of sympathetic neurotransmitters, antagonize effects of norepinephrine at beta-1 cardiac receptors. Antiarrhythmic drugs restore normal rhythm patterns, but do not cure the cause of the irregular heartbeat. Sorry, I had just read that. Now we're going to look at class 3 antiarrhythmic agents. These block efflux of potassium positive ions during repolarization phases 1 through 3. And class 4 antiarrhythmic agents block pathways for calcium entry to excitable membranes of the heart and blood vessels that develop action potentials. Table 29.6 is on page 470. This details prescription treatments for arrhythmias. Table 29.7 is on page 471. These are antiarrhythmic agents. And table 29.7 continues through page 472 in the textbook. So now we're going to look at the treatment for heart disease. This begins on page 473. The first treatment we'll look at is cardiac glycosides. These increase the force of myocardial contraction without causing an increase in consumption of oxygen. Increase blood flow and kidney filtration. Hypokalemia increases toxic effects of glycosides. Digoxin doses are highly individualized and go by the trade name of Lanoxin. Diuretics, sometimes called water pills, eliminate excess sodium and water via the urinary tract. They are used to treat both hypertension and congestive heart failure. So there are 4 categories of diuretics. Thiazide for mild to moderate diuretic effects, most commonly used for congestive heart failure, also for edema, hypertension, and renal impairment. Loop diuretics work in the loop of Henle within the kidneys, moderate to potent effect, used for acute congestive heart failure and edema. Potassium sparing diuretics allow water loss without loss of the important electrolyte, and carbonic anhydrase inhibitors reduce amount of aqueous humor and decrease intraocular pressure. Table 29.8 is on page 474 of the textbook, It details the thiazide diuretics. Table 29.9 is also on page 474 in the textbook, detailing loop diuretics. Also on page 474 of the textbook is table 2910, detailing potassium-sparing diuretics. And on page 475 of the textbook is table 29.11, detailing the carbonic anhydrase inhibitors. Vasodilators, this begins on page 473 in the bottom right corner and finishes up on page 475. They allow more blood to exit the heart, preventing or mitigating congestion, and they lower blood pressure. Used alone or with a cardiac glycoside and diuretics to treat congestive heart failure. NitroBid, which is a nitroglycerin ointment, relaxes smooth muscle. Peripheral vasodilators work directly on blood vessels in arms and legs. Table 2912 is on page 475. It details peripheral vasodilators. Table 29.13 details coronary vasodilators. This is on page 476. On page 475, we're going to look at ACE inhibitors. ACE stands for angiotensin converting enzyme. And then they are inhibitors, so they're ACE inhibitors. They lower blood pressure, thought to reshape the heart, prevent the body from producing natural vasodilators. Drug of choice for congestive heart failure. Block conversion of angiotensin 1 or AT1 to AT2. And these are going to have a suffix of pril on the generic name. Most of them. So for ACE inhibitors, remember pril is the suffix used for those. Table 29.14 on page 476 details angiotensin converting enzyme inhibitors or ACE inhibitors. And that continues to page 477. Angiotensin 2 receptor blockers, page 475, bottom right corner. These are similar to ACE inhibitors. They block the body's natural vasodilators by blocking A2 from getting into the AT receptors in the blood vessels. Table 29.15 on page 477 details angiotensin 2 receptor blockers, angiotensin 2 antagonists. And that table goes over through to page 478. Beta adrenergic blockers begins on page 478. They block beta 1 and beta 2 receptors from receiving the sympathetic neurotransmitter norepinephrine or NE and epinephrine EPI. Results in decreases in heart and pulse rates, vasoconstriction, blood pressure, force and contraction rate of heart, oxygen consumption, breathing rate, and bronchodilation. Mitigates hypertension, angina, cardiac arrhythmias. Table 29.16 is on page 478, details non-selective beta adrenergic blocking agents. Table 29.17 is on page 479, detailing selective beta adrenergic blocking agents. So adrenergic agents begins at the bottom right of page 479. These interfere with manufacture of vasoconstrictors at nerve endings. Because less norepinephrine is being made, anti-adrenergic agents are stored as a false transmitter and released like natural norepinephrine when needed. Table 29.18 is on page 479 in the textbook. Coronary artery disease begins on page 480. Okay, so coronary artery disease begins on page 480 in the textbook. This refers to insufficient blood flow to the heart via the right or left coronary artery, usually due to arteriosclerosis, which is a hardening of the arteries. Over years, calcium buildup on artery walls makes them thicken and lose elasticity, becoming hard and brittle. And atherosclerosis, which is a buildup of plaque on walls of coronary arteries, hardening them. So table 29.19 details prescription treatments for antiplatelets. You can find this table on page 481 of the textbook. Table 29.20 is also on page 481 of the textbook, detailing antiplatelet agents. Table 29.21 details a comparison of antiplatelet agents. It is also on page 481 in the textbook. So anticoagulants, back on page 480. Anticoagulants prevent clots from forming or existing clots from getting bigger. Erroneously called blood thinners, but they do not actually thin the blood. They just prevent the platelets from clotting. It cannot dissolve existing clots, and this would include things like warfarin and heparin. Table 29.22 on page 482, on page 483, details prescription treatments for anticoagulants. Tissue plasminogen activators, or TPAs, are found on page 482 in the textbook. These chemically break down blood clots by reversing clotting order and interfering with synthesis of various clotting factors. Tissue plasminogen activators must be administered by parenteral infusion within a window of opportunity to avoid intracranial hemorrhage. Table 29.24 details thrombolytics and tissue plasminogen activators, and that is found on page 483 in the textbook. Thrombin inhibitors is on page 484 in the textbook. These inactivate bound thrombin by binding to enzyme and blocking interaction with substrates of fibrin. Active site directed thrombin inhibitor, argatroban, binds to thrombin without displacing fibrin, which inactivates the thrombin so that it cannot form a clot. Bivalent direct thrombin inhibitors such as hirudin and bivalirudin, and I apologize, I may be saying those slightly incorrect. These displace thrombin from fibrin during binding and the inactivation process. Table 29.25 on page 484 details thrombin inhibitors. So antidotes for overdose of antiplatelet or anticoagulants. So for the drug warfarin, if an overdose occurs, vitamin K is the antidote. For a heparin overdose, protamine sulfate would be the antidote. Thrombolytic enzyme overdose, you would use aminocaproic acid or tranexamic acid. And I may have said that last drug slightly wrong. Now we're going to look at cholesterol, which begins on page 484 and very quickly moves to page 486 in the textbook. Cholesterol is a waxy, fat-like substance that is found in all cells. It is needed to make hormones, vitamin D, and digestive substances. Hyperlipidemia refers to high concentrations of lipids in the blood. So there are 5 categories of lipoproteins. These are detailed in bullet points on page 486 along the left. Chylomicrons, very low density lipotropins or VLDLs, intermediate density lipoproteins, IDLs, low density lipoproteins or bad cholesterol referred to as LDLs, and high density lipoproteins or HDLs referred to as the good cholesterol. Table 29.27 on page 486 details cholesterol levels and the ranges that they should be in. Table 29.28 is detailing the high density lipid or HDL levels, the good cholesterol, and what ranges those should be in. Table 29.29, also on page 486, details the low density lipid levels or bad cholesterol. Now we're going to look at triglycerides. This is a form of energy stored in adipose and muscle tissues, gradually released and metabolized between meals as the body's energy needs fluctuate. Measured to depict fat ingestion and metabolism to assess coronary artery disease risk factors. Chylomicrons, which are produced in the intestines, deliver dietary cholesterol and triglycerides. The table 29.30 on page 486 details triglyceride normal ranges for healthy adults. Anti-hyperlipidemics, still on page 486. These are drugs that help prevent the progression of coronary artery disease by lowering plasma lipid levels. They're useful in treating diabetes insipidus and in prevention of stroke and myocardial infarction. Statins are highly effective in lowering LDL cholesterol, suppress cholesterol synthesis by inhibiting the enzyme HMG CoA reductase. And it didn't detail it quite as clearly, I don't feel like, as it did with the ACE inhibitors ending in "pril" for their suffix. But this last statement, statins are highly effective. You will find that most hyperlipidemics have a suffix of statin on the end of them. Look at the generic for Lipitor, atorvastatin, the generic for Zocor, simvastatin. So most of those are going to have statin attached to the end of them. Generic for Crestor is rosuvastatin. Generic for Lescal is fluvastatin. So again, statin is usually going to be your anti-hyperlipidemics. Table 29.31, prescription treatments for hyperlipidemia. And you can see there's that list of statins. There's 1, 2, maybe 3 or few handfuls of drugs on this list that do not have statin in them. The majority of these end in statin on the generic name. The lovastatin, simvastatin I already addressed, pravastatin, atorvastatin I had already addressed. The generic for Livalo is pitavastatin, fluvastatin for Lescal, so statin for your anti-hyperlipidemics. Now we're going to look at the lymphatic system. Lymphatic system is found on page 488 in the textbook. This is a complex system of lymph organs, nodes, ducts, tissues, vessels, and capillaries. Transports lymph fluid to the circulatory system. Cardiovascular and lymphatic systems work in tandem, joined by a capillary system through which lymph and blood move. Lymph fluid moves by contraction of skeletal muscles, not pumped. Bone marrow produces lymphocytes, monocytes, and leukocytes. Lymph nodes are areas where lymphocytes concentrate along the lymphatic veins. So the lymphatic system supports our immune system by filtering out organisms that cause disease, producing specific white blood cells, manufacturing antibodies, distributing fluids and nutrients throughout the body, and draining excess fluids and proteins so that tissues do not swell or become inflamed. So our summary is on page 489 in the textbook. Cardiovascular or circulatory system transports blood to all parts of the body, consists of the heart, arteries, arterioles, veins, venules, and capillaries. Heart relies on conduction system comprised of nodes and nodule tissues that regulate various aspects of the heartbeat. Most common diseases, congestive heart failure and coronary artery disease. And that concludes the lecture for chapter 29. We have a little more time to spend in class with this particular chapter. However, I chose to go ahead and pre-record the lecture because that was 94 slides that we just went through. And I just didn't want to feel rushed when we get together as a group. I want to be able to address questions that you have. I wanted to be able to allow time for you to address anything that might be confusing or unclear. So I felt it best, even though we have a little more time in this particular chapter, for us to go ahead and cover the recording of the lecture. It's done, it's out of the hairdo, and now we can use our live Zoom time to address or maybe pinpoint in on some other areas and address the chapter review before we get ready to take the exam. So I hope this lecture has been helpful to you. As always, please reach out if you have questions, if anything's unclear. No matter how big or small you feel like it might be, reach out if you have questions and we will get those worked through. So until we meet again, I hope you have a great day and bye-bye for now.